Stats out this week suggest that GPs are increasingly turning to drugs and alcohol in order to deal with workplace stress. Unfortunately, this is symptomatic of a wider workplace issue of substance misuse. It's therefore really important that employees know how to deal with such workplace concerns. The first step to resolving such an issue is to identify that there is in fact a substance misuse concern. The following might indicate that there is such a problem: poor attendance, poor performance, or a change in workplace behaviour. It is imperative that employers don't make assumptions about the underlying cause, and if employees are unwilling to admit to a substance misuse problem, employers should proceed with extreme caution. Once employers have identified that there is in fact a substance misuse concern, it's really important to then properly investigate the matter. Contracts and policies need to be checked to make sure whether drug screening or locker searches can be performed. Even if the contracts and policies do allow this, employers should think carefully about the logistics of such activities. It's also important to consider whether contracts and policies need updating to ensure these kind of activities can be used in the future if necessary. Employers need to consider whether they need to follow a capability or a disciplinary procedure. Either way, they need to make sure that an appropriate procedure is followed, whatever the circumstances. Employers will also need to consider whether their industry or sector requires a sympathetic or zero tolerance approach. It is really important that employers remember that with the correct support, somebody can recover from drug or alcohol dependency.